17-year-old Jared Hauk is meeting with his rheumatologist to check on his diagnosis of juvenile idiopathic arthritis.
It's arthritis that affects children under age 16 at the onset of it. Basically what happens is the immune system, instead of fighting an infection, it gets confused and targets your own body, and in this case it targets the joints.
Jared was diagnosed with juvenile arthritis 6 years ago.
I was at an appointment with my sister, and Dr. Johnson was the rheumatologist that my sister was seeing, and she noticed that I was kind of stiffer, and then my parents said that they noticed a couple of things that was happening, like not playing with Lego or drawing in school or writing because it hurt my hand.
We noticed that he was very stiff in his hands. So not a lot of swelling, but we certainly noticed that his joints weren't moving well, and as a result it brought challenges for small skills in his hands, and he was having a lot of pain.
Over the years, Jared and Dr. Johnson have developed a regime to successfully treat his disease.
It's multidisciplinary, and that's probably the ideal way in which one wants to treat arthritis. So there is an approach from the understanding point of view, educating him that he was correct in saying that his stiffness was not normal, and then introducing medications that are immunosuppressive so that we can calm the immune system. We also made sure that we did what we could for pain. And on top of that, physiotherapy and occupational therapy to stretch his joints, move them, get them back to their strength and function and movement. And then psychological support.
For my physio, it's just stretching my shoulders out and back. My hamstrings are very tight as well. And then just kind of warming up my hands and just stretching them out every so often.
As Jared approaches adulthood, he's in the process of transitioning from the rheumatology program at the Children's Hospital and into the adult healthcare system, something he finds a little daunting.
It's a little bit harder than what it is at the Children's Hospital because I have my parents that are helping me, and I have Dr. Johnson, who's been a big help. But there are things like my health passport on the website at the Children's Hospital. There's youth in transition. And the yard clinic, they also have that here. So they give you some things that can help you transition over to the adult healthcare.
And as Jared ages, it's hoped he won't develop any further debilitating forms of arthritis.
Ideally, if we have good control on your childhood arthritis, you have good healthy joints, so then you don't get a secondary osteoarthritis. But the one thing we are not able to say at this moment in time is that we have a perfect cure. What we do have are fantastic medications and ways in which we do a team approach to make it that the children live a good life, a healthy life, they grow well, they achieve all of their goals with as minimum pain as possible.
Right now it's manageable, and I just kind of want to live a normal life.
For Go in Calgary, I'm Karen Koppitz.